My name is Dr. Jamie Laws, and I'm from Toronto, Canada. And I want to share a story, again, something that I would consider to be a miracle. I want to share a story about working at the Canada Games in 2001 in London, Ontario. And I had the good fortune of working as part of the host medical team in London for the wrestling competitions. And this is where teams from all across the country come province by province. They send their best athletes to compete for an overall Canadian championship. And in wrestling, there's individual competition, but the individual competitions are added together in order to make the team competition. So each athlete has to perform well for their own sake, but every weight category is counted into the point total for the whole team. And so it's also important that you have somebody competing in every category that's going to do well. And this story is about one of the athletes who is a super heavyweight. And on the second day of competition, in the team competition, he's competing. And close to the end of his bout, he was headbutted from the side and his jaw was dislocated. But when your jaw is dislocated, normally it's such a traumatic event that you're not able to speak and actually let anybody know that your jaw is dislocated. So we didn't really know that anything had happened until after the bout was over. So he held on for the last minute or so of the bout until the bout was over. And he was judged to have won the bout on points. And it wasn't until then that we could see by the expression on his face that he was in difficulty. But even then, he wasn't able to say anything. And so it took time to be able to work out what had happened, and the fact that his jaw was dislocated and locked, and he only had less than half an inch of movement, and was in obviously tremendous pain. And it's at that point that we went to do whatever we could to help the athlete. And in this circumstance, it's a multidisciplinary healthcare team, so we have medical doctors available, we have physiotherapists available, we have chiropractors available, and nurses and athletic therapists, and we have a good multidisciplinary group available. And so we worked with this athlete. The next scheduled competition for him was in about 4 hours. And again, in terms of team competition, if he didn't compete, it's likely that the team is not going to win. So there's tremendous pressure from the coach in order for him to be able to compete. The medical doctor who was looking after the host team at the time said, well, we can deal with this. We can send him to emergency by ambulance, and they'll give him a general anesthetic, and it'll be easy to put the jaw back in. And I said, yeah, but if we do that, then he won't be able to compete tonight because he'll have to recover from the general anesthetic, and that won't happen. And he said, well, you're right. He said, what else can we do? And I said, well, if you'd like us to, we can do what we can and see if we can reduce the dislocation without general anesthetic. And he said, I think that's a good idea. He said, I can help. He said, because I can give local anesthetic around the jaw, and the local anesthetic will at least reduce the pain, and that should help with some of the muscle spasm, and that should make it easier for you. So what we did was, he had the local anesthetic, and that did help, and that helped significantly. And the whole time, as the local anesthetic was starting to take effect, we started working on the musculature in the neck, the musculature in the upper back, to relax those muscles as much as possible, to realign the spine just in terms of general alignment to get things as good as it could be. And then there were two of us as chiropractors who were there that were able to help do this. And so one of the chiropractors held his head, and I intervened with the jaw and tractioned the jaw downwards, and with repeated work was able to reduce the dislocation. So we got the dislocation reduced. Once the dislocation is reduced, there's a huge relief of pain. The athlete was able to open his mouth, he was able to talk, he was, felt tremendous relief. But then the next question is, should he go and compete. And so we evaluated the situation, and the decision of the medical team was that it would be okay for him to go ahead and compete. So we went on and he competed that night, and the Ontario team won the gold medal as a team, and they wouldn't have done that if he hadn't competed. But they still had the individual championships the next day. And so we treated him before and after his evening competition. We treated him again the next morning, and he had 2 bouts the second day in the individual competition, and he won an individual gold medal, having had a dislocated jaw the day before. So he was very pleased. I can tell you that the entire host healthcare team was very pleased, and that's the kind of thing that can happen when chiropractic is included in part of the healthcare approach to treating sports injuries. So I think that's something of a chiropractic miracle, but more so, it's a miracle for the athlete who has the chance to go on and help his team win a gold and then win an individual gold medal himself.